Millions of people have successfully undergone breast augmentation over the years. When done correctly, breast augmentation can bring self-confidence and much happiness to the right patient. But as with any other important decision, there are pitfalls, which are best to be avoided. First and foremost, the decision to undergo breast augmentation should be a very personal decision made by the patient without influence or prompting from friends, relatives, or significant others. In my experience, my happiest patients choose to have plastic surgery independently and very thoughtfully. I always tell them, try not to have plastic surgery on a whim. As a patient, you should explore the variety of options in terms of your desired size, breast shape, implant type, whether silicone or saline, implant shape, whether teardrop or round, location of the implant, whether under or over the pectoralis major muscle, or whether you may or may not need a breast lift in addition to breast augmentation. Remember that bigger is not always better. There is always a best range of sizes and shapes for every individual patient based on the width of her chest, the diameter and height of each breast, and the amount of breast tissue. Paying attention to these factors ensures that you have a long, natural lasting result and a smaller chance of deformity or breast droopiness later on. It's very important to make sure that you choose a plastic surgeon certified by the American Board of Plastic Surgery with ample experience in breast augmentation. But also make sure that your surgeon is experienced with much more complicated breast operations, such as a revisional breast surgery. During the time of consultation, make sure that your surgeon spends time to listen to you and really learn what you're looking for. Bring photos if you like, and make sure to spend time during the consultation with the nurse trying different size implants in front of a tall mirror to choose the best implant size and shape for your body. Your surgeon should spend time to discuss the positives and negatives for each implant type, whether saline or silicone, smooth or textured, highly cohesive versus the less cohesive implants, which are softer, and shaped versus round implants. He should make time to make measurements to ensure that your implant size is correct for your body. This is very crucial. During the consultation, you should discuss the location of the incision, the site of the implant, implant type, shape, and size with the surgeon. There are numerous studies out there that have shown better outcomes with one of many variables, whether it's the implant type, such as a textured implant versus a smooth implant might decrease capsular contracture. The location of the implant, many studies have shown that by placing the implant under the pectoralis major muscle, we can decrease the chances of capsular contracture by 40%. And also, most recently, there have been studies that show that when the location of the incision is moved away from the nipple areola, the chances of breast hardening and capsular contracture are significantly reduced. The abundance of all these studies have made breast augmentation a very safe and reliable procedure. And even the best surgeons are guided by these outcomes to perform the best procedure for each patient. So make sure that you spend time with your surgeon discussing all risks, potential complications, especially implant warranties, and the FDA requirements for MRI or magnetic resonance imaging of silicone implants, which are recently being stressed. Ask your surgeon if he uses the no-touch technique during surgery, which could also mean that he might use the Keller funnel. Ask him if he uses the Keller funnel for inserting his silicone implants, which would minimize any possible damage to the implant during the time of insertion of the implant. Ask your surgeon if he feels very comfortable in managing any possible poor outcomes should they ever occur. Look at before and after photos with the nurse during or after the consultation. It's important to make sure to follow all of your surgeon's recommendations in preparation for the time of surgery, such as avoiding aspirin and non-steroidal anti-inflammatory medications such as Motrin for at least 1 week before surgery. A complete preoperative workup with a family physician or internal medicine doctor is also a very important thing to do to avoid any surgical anesthetic risks. Finally, by spending time to educate yourself about breast augmentation and by making the right choices leading up to your surgery, you can help ensure a very positive experience and beautiful, natural, long-lasting results.